is Sandra Wall, and I am the rank and file chapter vice president of the union. Our main issues are our health care. Our health care is way too expensive. Our cheapest Kaiser plan is almost $800 a month.
You're paying $800 a month for your medical care?
Actually, I chose CCHP, so I have the Medi-Cal plan, and that's going to go up in January to $400 a month. I can't afford the Kaiser plan of $800. When I started 18 years ago, that same plan was $25. So that's an issue. Our safety is an issue. We've had serious safety concerns in the workplace. We've had shootings. We've had violent attacks. And workers are not being informed. Workers are being left in danger. And our wages. We've had a survey that shows that our wages are 25 to 31% below our Bay Area surrounding counties, and it's not sustainable any longer. With the low wages and the health care, we're just not able to make it anymore. So I've been at the bargaining table since March. Nothing is happening. Actually, yesterday the county walked out at 12:30 and said they could not meet with us in the afternoon. We were willing to go all night to avoid the strike, and they walked out at 12:30 yesterday, so here we are.
So how does a social worker survive when you're paying so much money for your health care and really just the living costs in the Bay Area?
I have another worker from Health Services that works in the county sleeping on my couch. She could no longer afford her rent. I was losing my little lottery home that I bought in Napa County about 10 years ago. So right now, her and I are helping each other, but you don't make it. And that's why I kept asking myself, what am I doing wrong? Where can I cut back? But when I looked at my checks, and they were higher in 2006 than they are now in 2016, it's a pretty sad state for us.
And what do the managers say? I mean, they know that you're facing these problems.
Well, their chief negotiator who we're negotiating with, Bruce Hyde, he's from IEDA, has acknowledged that yes, we do have a retention and recruitment issue. The board has acknowledged we have those issues. However, they said that there is not enough money for us. There's nothing they can do for us. However, they gave the sheriff 17.5%. CNA gets what they want. I don't begrudge those unions. They deserve it. They have hard jobs, but our jobs are hard as well. We protect children on the streets. We are the front line for our community, and we are the safety net for our community. And we've got vacancies, and when our vacancies are low, we are not able to do the work and serve our community like we're supposed to. We did just discover through an information request that the county left $21 million on the table in the last 3 years that they lost due to not meeting benchmarks by having vacancies and our workers not being able to get things done. That's tax dollars that were supposed to come to this county that we lost.
And the effect on children who you're supposed to be serving, I mean, what are the kind of dangers that arise when children aren't being taken care of, people who need help?
Well, unfortunately, the ultimate is death of a child, and we've had that happen. We've had social workers there saying stuff is going to happen. Right now, we've got issues with IHSS. It's taking 6 months for social workers to get out and assess somebody who needs services, and we did have an incident not too long ago based on that. So those are the tragedies that occur when social workers are not able to get out and protect these families.
So people are dying because you can't do what you should be doing.
Yes, they are. Yes, they are.
What does management say about that?
Management hasn't had a comment on that. They don't comment on that. Yesterday, Twa didn't even comment on us being at the board on Tuesday. He said he'd leave it for the table, but nothing's happening there. They walked out at 12:30, so there was nothing for us to do.
Are you ready to fight? Damn right. Are you ready to fight? Damn right. Are you ready to fight? Damn right.
My name is Rene Castillo. I'm from the Bakers Union, Local 125, located in San Leandro, California. We're here to support our brothers and sisters, because of the labor movement. I mean, it's really going down, and we need all the support we can. So I'm telling all the other unions around here locally to come and support our brothers and sisters.
I was interviewing some of the workers here, and they say that they're having trouble surviving in the Bay Area. I mean, is this a problem your members face as well?
Yes, I mean, the high cost of rent that's going around here in the Bay Area and the low wages, it makes it really hard for people to live here in the Bay Area. I mean, because of the high cost of living, it's really, really hard. It's not like we're trying to gouge the companies to get more money. It's just, we just want to survive. The middle class is going away, and we need to survive, and we need to make sure that these people get decent wages and health care.
Okay, thank you.
Their health care is so ridiculous. It's up to $1,200 a month that they're paying per month on their health care.
So you're saying your members at Safeway are
Safeway retail, there's some members paying $85 a week on their health care. I mean, our health care system is ridiculous. The Obamacare, I don't think it's really working because there's a cap to it where you can't, if you make so much, you don't qualify. So our health care is a big issue, even in our local union, Local 125, where we're seeing that some of our members are paying so much money, and when our contract comes up, we're going to be fighting that too.
Now, I mean, if your members are paying that kind of money, $1,200 a month for health care, how do they survive with your wages?
I mean, it's what they do. You know, they try to get all the overtime that they can. Some of them have second jobs to go to cover this. I mean, it's ridiculous. It is.
And living in the Bay Area right now with the cost of housing, I mean, workers, how are they supposed to make it?
I mean, what we've seen is some workers, they get an apartment and they have another family. So there's two families living in an apartment to cover the rent for each month. I mean, it's ridiculous. The rent cost around here in the Bay Area is ridiculous.
What needs to be done?
I mean, there has to be some kind of rent control, what they can do on their salary wages. Something has to be done where all the unions have to get together, and we need to stay strong and rally about this, because this is really ridiculous for the middle class person that is averaging $50,000 a year. They can't afford it. They can't afford to stay in the Bay Area.
So why don't you introduce yourself?
My name is Champagne Brown, and I am a social service program assistant here in Contra Costa County.
So what are the issues for you as a social worker in Contra Costa County about the action today?
The issue right now is we really want to protect our families. Because some of our departments have up to 40% vacancies, it's really hard to do what it is that we need to do. And at the end of the day, it's our families that's suffering because they're not able to get the services that they deserve.
And how does that affect families or children in Contra Costa County?
How that affects families and children is that if they walk through our doors seeking help and they're applying for any of our programs, for the most part, we're mandated to approve those applications within 30 days. We have families that applications are not being approved for months on end. So that family could be facing homelessness. They may not have no food in their cabinets, and they could be facing a medical crisis. But because we cannot process in a timely manner, those families are suffering even more trauma than they already need to.
So you're talking about a potential life and death situation?
Yes, I am. Yes, I am.
Have there been any incidents where people...
Not that I know of. I did hear of one story where there was a gentleman who was trying to get in-home supportive services for his elderly mother. The application is still pending, but unfortunately his mother has passed away. And again, that's because the social worker was unable to get out there in a timely manner to do the necessary assessment, so therefore that family could get the help to take care of that member.
And how far understaffed are you here at this facility?
Some departments have up to 40%. And then I know in our child welfare department, the majority of those workers are new. They've been here for under 3 to 4 years. It takes a long time for you to be really competent within child welfare because of the complexity of that particular program, because you are dealing with children, going out to the home to assess the danger, and you have to make a decision of whether or not that child is safe in that home or if you have to remove. But we're unable to get veterans here because we're not competitive with the rest of the Bay Area.
And the social crisis in the Bay Area, housing, I mean, people surviving, how are working people going to survive with the kind of incomes that they have and the housing crisis here in the Bay Area?
It's very difficult. I have co-workers that's coming as far as Matika in the Stockton area, and they work here in West County. So you're looking at a minimum of a 2-hour drive each way.
So what is the future? It seems like it's getting worse and worse for working people.
It is, and right now, unfortunately, I don't necessarily have an answer. You know, all I can do is try to help one family at a time, you know, to try to help bring them up out of poverty. It's very hard. You know, besides what we're fighting for, we need to fight for fair rents around here, you know, more affordable housing, so that, you know, the natives here are not being pushed out further and further away. Yeah, I just had a friend that was living here, and she works for Kaiser. She had to move to the Central Valley because she could no longer afford the rents here. So it's getting bad.
And the amount of money that you're paying for Kaiser, I've heard it's like 800. I mean, what is going on with your cost of healthcare?
Our healthcare is ridiculous. Honestly, had I really known what our benefits looked like when I first relocated here from the Central Valley, I would have went right back. It's a shame that I worked for Madera County, which is in the Central Valley, a very rural county, and I was able to afford my Kaiser there. But I come here to the Bay Area, and I cannot afford county, so I have CCHP, which is the county health plan. So I basically have the same health plan as our families, which is fine, but even that is going up, and that's becoming even more unaffordable. So pretty soon we're going to have to make a decision of whether or not we can even afford our housing because we're paying so much towards our medical.
Yeah, it seems like there's a social crisis in the Bay Area. A lot of people can't survive. They're being told they have to move someplace else, yet they need workers to do the jobs here.
Exactly. Unfortunately, with the tech industry, some people say with gentrification, it's just becoming really, really bad. And again, I think one of our solutions is we have to really look at the housing situation that we have. We need more affordable housing.
Okay, thank you.
No problem.
You have kind of solidarity. What kind of solidarity do you have today?
I'm sorry, I couldn't hear you.
What kind of solidarity do you have today? Do you think you're got a lot of solidarity among the workers?
Yes, unfortunately, we have good numbers out here, but a lot of our people that work in West County, either they live in Central or East County because the rents are rising here, they're getting pushed further and further out. I actually used to live in East County, but because I worked in West County, I made it my mission to move here because I wanted to be, within the mix of things where my clients are so I can truly understand them as I'm helping them find employment here in West County. But our numbers are good in East County because, again, most of our people live in East and Central, but they work out this way.
What does it feel being a social worker and not being able to help people that really need help? How does that feel?
It's painful. I actually go home with it every day. One of the main issues that I see is the homelessness, where now we have our clients that are couch surfing because there's nowhere for them to go, and that's painful. It keeps me up at night trying to figure out, how can I help these families? What other services are out there that I can refer them to try to help them with their situation. It's very hard and it's very stressful. Very hard and very stressful.
My name is Carlos Taboada. I'm a candidate for the West Contra Costa Unified School District School Board, and I'm here to express my support for the workers on strike because they are setting an example for everyone. They are setting an example for teachers. They are setting an example for carpenters. They are setting an example for everyone. And I just want to let you know that we are in the same fight. We are on different fronts, but it's the same struggle against the union busters, the privatizers, the venture capitalists, Goldman Sachs gang. That's the common enemy that we have. We're in different struggles, different battles, but it's the same enemy, and it's essentially the same war against these privatizers and these exploiters. So I'm here as a retired teacher to express my solidarity with this group of workers that, as I said, they are setting an example for everyone in this city.
Hi folks, first I want to thank everyone for coming out. It makes us feel so good and so proud about what we're doing for the people we're trying to serve, to have ACE here, to have RPA, to have our community allies, to have our friends in office. Thank you so much. We appreciate it. We're here today and we're doing what we have to do. Granted, we've got smiles on our faces and we're dancing on the streets. It seems like a lot of fun, but what's not a lot of fun is we have to do this because we have a county that is breaking the law. And it did that when we spoke out about the problems we have trying to deliver services to our most needy people. These are children, these are victims of exploitation and sex trafficking. These are hungry people trying to feed their families, and for whatever reason it's almost incomprehensible that this board will not do what it needs to do to get the state and federal money that's supposed to be going here to deliver these services. They're letting it go away. They let $21 million away over the last 3 years. So thank you again for coming out. I believe what we're doing is right, and I appreciate your support.
My name is Pam Ramirez. I worked for Alta Bates for many years, and we were always in these kinds of fights where corporations just put down all kinds of stressful requirements, more work in an 8-hour shift than anybody can do, didn't give us any control over our schedules. These guys are working. That's a very important aspect. Our community is poor. We have lots of people who need help. We need 100% employment in this department so that those people can be helped.
My name is Sashi Alvarez. I'm a welfare to work worker here at 1305 McDonald in Richmond with the Contra Costa County.
And what kind of work do you do?
I'm in welfare to work, so my job is helping needy families who are unemployed to find and retain employment, and I provide them with the services to do that.
And what's going on here today?
What's going on today is we're fighting for the vulnerable residents of our county and the families in need in our county, because currently, due to understaffing, we don't have the resources to serve our community, and we want our community to be healthy and thriving, and right now we just can't do that, so we're here fighting for that.
And how does that personally affect you as one of the workers here at this facility?
As one of the workers, it's very frustrating for me because I want to help my clients who come through the door. I want to get them employed and retain those jobs, and I just don't have the resources right now to timely provide them those services so they can get employed and stay employed.
So how long do people have to wait to get the services?
It varies depending on what position you're in and what service you provide.
How understaffed are you?
I can't speak to the exact numbers on that. I can just tell you that we don't have the resources we need to really help the community that we serve.
And how long have you worked here?
I've worked here for 3.5 years.
How many other workers are out here on strike today?
We have 1,100 members within our county that are on strike.
My name is Carla Jewell, and I'm showing support for my fellow workers who are eligibility workers and social workers. I'm a member of the Clerks Union, and we all share the same fight.
And some of the workers here were saying they're spending $800 a month for health care cost. What is going on with that? I mean, it seems like...
Apparently, I'm new to all this, but apparently what happened was in 2008 they took cuts to keep everybody's jobs, so that it was a mutual sharing. And then what's happened is in the new contracts that we're all taking on, we're just now gaining back what they've taken, but they've expanded the cost of our share of the medical.
Is that cost shifting?
Yeah, for Kaiser, for 2 people, is $775. It's prohibitive.
I mean, how do people do it with the cost of living in the Bay Area and everything else?
You do what you got to do, but you want a job, and you need the health insurance, so we just do what we do.
So AFSCME is represented here too in this facility?
I'm showing up to show my support, so I'm not at work yet, so I'll get docked pay for being late to show their support, but I wanted to show, these are all the people I work with every day.
Thank you, Kim, and thank you, workers, for fighting for all of us out here tonight. All of us are here today. We've seen in this county, as the leader of the Labor Council, I watch 7 to 8 bargaining units go up against this Board of Supervisors and their management staff in contract after contract, healthcare reopener after healthcare reopener, this union here, and every single one has to go through such a nasty fight.
Right.
And part of it is because this particular Board of Supervisors, I don't think read the job description when they ran for the office, right? This is the Board of Supervisors is in charge of and held with the duty to provide basic services, critical services like healthcare, like transportation, like housing, and they scratch their heads and say, no, we have no money. We have no money. You know, our annual fundraising dinner is tonight. And one of the things that I'm going to be telling folks is what we already know here, is that Contra Costa is the fourth wealthiest county in the sixth largest economy in the world. Let that sink in. We are the fourth wealthiest county in the sixth largest economy in the world. And we aren't providing enough SNAP and food services. We have food insecurity. We have buses that don't service underserved communities, right? We're closing hospitals and emergency rooms. And intake coordinators and eligibility workers and the social workers, as well as the other county employees, want to provide the best possible service, critical services to their neighbors and the community in need, and they get told, no, we can't, there's not enough. And there's certainly not enough of you to deliver the services because they're not putting the money where they need to put the money. Right. They're not valuing the work you do, and they're not valuing the clients who, by the way, are our community, the very people they're supposed to serve. So I just want to say I've watched for 3 years as bargaining units have gone to bargain, like I said, healthcare or a full contract. And one thing that we do know is when you fight, you win with this Board of Supervisors. When you fight, you win. And that's the chant, right? When we fight, we win, right? Yeah. You cut me, I bleed purple. That was my first union job. So what you're doing today is going to change the dynamic, and it's going to change the power structure, not just for you, for everybody in the county and your clients. I want to thank you for doing that today. And I also want to say that we have a historic opportunity right now in the next 30 days. Not on November 9th, not on November 10th, not next year. Right now, you have one open seat on the Board of Supervisors. Mary Pivo never, ever, ever gave you a vote and never will give you a vote. So if you want to change the dynamic in Contra Costa for the next 30 days, 10 shifts, 20 hours, to elect the labor-endorsed candidate, Diane Burgess, in the Board of Supervisor 3. We walk, we talk, we phone. We're working every day. And the other is Ana Maria Villa Farias in Board of Super 5, because we can't wait for Federal Glover to finally know who you are. Okay?
Justice? No peace. No justice? No peace. No justice? No peace. So what do we want? CalFresh. What do you can't hide. We can see your greedy side. You can't hide. We can see your greedy side. Show me what you got. Show me what you got. Show me what you got. Show me what you got.